David, thank you for this kind introduction. He was one of my best students. And the word perseverance will shrink to the amount of activity that David does for anything. So I'm glad to have him here. I want to start with thanking you all. It's a pleasure to see you coming back here and make me feel that the work we do at WACAG is worthwhile. Seeing you all here, really bringing tears to my eyes. I'm grateful and honored to see you all here today. And as a life of surgeon, not all the time that fortunate helped me to get success at the end. And when we fail, it's quite a difficult time. So it's nice to see one's successes, and that's great. I want to start the conversation by being thankful to being accepted to live in New Zealand and to be a part of the New Zealand community, to congratulate you about the support of women, so 150 years of women voting and doing things that in other countries they couldn't. I think that's great. I do remember my mother vividly wanted to be a lawyer, and she graduated from the law school with my dad, but when she wanted to get a job, the head of the firm said, "What are you doing, you pretty girl, doing law and stuff like that? Go home and cook for your husband." And I'll never forget that. So living in a country where a young woman is our prime minister, and she is happy to share her family with us, and she is a wonderful woman. I think I am really honored to be in this country, and thank you for having me as a member of your community. That's number one. Number two is another thing that over the years I have learned something that is very interesting, and I'm going to share that with you. We do think of science as black and white and accurate, and we wish one day we will be. But to tell you the truth, over 30 years of practice, I've realized that we sometimes make a decision on very sketchy pieces of information, and we need a bit of luck and a bit of fate to help us to get the outcome we need. And that's not to worry you guys, but it's the reality of the human condition. We don't know everything. We know a little bit of how the human body works, but not everything about everybody. And I'm gonna, in my talk, which I wanted to be interactive, I don't want to leave the question till the end. I'm gonna through and talk to you all, and as we're talking, slide by slide, if you have any questions, please stop me and interact with me to try to explain really some of the stuff that I try to explain to you when you are not well. But it's impossible because, in that state of mind, you just want to make it through, and you trust the surgeon or the group of people who are looking after you, and the details don't matter. You're just in a desperate state to get through this. They told you it's high risk, they told you it's bad, and you're thinking, okay, I hope these guys know what they're doing and they can do a good job. So I'm going to try today to explain some of the stuff that we go through, and I hope some of that will highlight to you what exactly is the treatment of that condition. Okay. Yeah. So, again, learn that this condition does not respect royalty, celebrity, money, and it does affect everybody. So that's the first recognized royalty who died of aortic dissection. This is the first physician who diagnosed it, and you can see on the 16th century, so it has been well-known condition. Despite of its rarity, it is well recognized long time ago. Now, we couldn't really do much to help patients before then, till the recent development in cardiac surgery, which started in the 50s. And I will tell you why in a minute. And then when those guys started to do it, they started to succeed and help people surviving this condition. And I will explain as we go along what exactly those guys have done in the past few years to make it possible for us all to treat a condition that is difficult. The human body is a very marvelous machine. and it is well regulated all the time. So I'm going to explain to you the importance of blood pressure we talked about earlier on. We all have a temperature of 37 because we have a thermostat inside our body that controls this. Our blood pressure is the same. We have a thermostat that controls the blood pressure to a certain level. Unfortunately, if the thermostat is faulty or the control dial has gone one way or another, you're either too high or too low, and then we have a problem. So the idea is that one cannot control their genes. I can't control my genes and be taller. I wish I was, but I can't. And neither of you can control the genes that giving you your organs and your body, but you can control your environment, and you can control what you do outside your genes. And that can give you a better outcome and a better survival and a better longevity. And we can all do that, and I will explain it as I go along. Now, one of the things that we talked about surveillance earlier on, although dissection is rare, but aneurysm disease is not. So what is aneurysm disease? And I've heard that sort of question earlier on. Basically, we all have pipes, and you all have pipes in your car, in the house, everywhere we have. These pipes need maintenance. There's a pump attached to them, and if you don't maintain them, they rust. And as we age, that's what happens. The wall gets weaker. Now, if you are of good genes, their pipes gets repaired all the time. So you are the age of 70, and your pipes is the same as you when you were 20. You're blessed with good genes. If you haven't got good genes, unfortunately your pipe are not going to be repaired well. And that's the problem. They become weaker and weaker as the time goes on. If you live our normal life now, which is very stressful, so, you know, the tax letter comes through, you are anxious about it, your daughter has got a boyfriend you don't like, you know, things happen all the time that make you uncomfortable. That blood pressure goes up all the time. And then, you know, something happened in your life, you are upset about it. All that is environmental factor that offset that thermostat and put your blood pressure up. And that puts strain on your pipes and, you know, damage them a bit more. Now you have, unfortunately, poor repairmen you inherited in your genes. They can't repair the damage. And if you keep damaging, if you smoke or do something else that increases the damage of the pipe, it gets weaker as the time goes on. And then we have a problem. And the problem is, you get this aneurysmal dilatation there. You can see that. So this is the normal size, and this is the aorta here, looking like a balloon. And this is what we see, what we see in theater. Yeah. Yeah? So, we have two types of surgery. One, prophylactic. So, accidentally, you went to have an echo, or you've seen a GP who's done a chest x-ray for something else, and they discover you've got this aneurysm thing. It gives you no symptoms. You wouldn't know anything about it. You can be healthy, fit, doing everything. And I have seen, you know, rugby players having this. So, at this stage, the operation is prophylactic. It's not catastrophic, it's not urgent, it's elective. And we decide to do it because of the size. We know that when these pipes gets to 5 centimeters or more, it will burst, and that will be the end of it. Or you'll come to hospital with a dissection, and that's again a very tough call for you guys, and I'll explain it in a minute. So if I do an aneurysm operation, the mortality or the risk of the operation is more or less the same as the risk of valve replacement, Waikato. It's not high. Different from dissection. When we have an aortic dissection, there is 1 in 4 chance that people will not make it, despite of the best effort I will do during the day, you know, and my team. Now, technology develop all the time. This is a casts of aneurysm of different people who have Marfan disease. And you can see they're not created equal. The shapes are different. They're not all made the same. And that's again something that people don't realize, you know? All the houses from outside maybe have 3 rooms or 4 rooms, but inside it could be completely different. The setup is a dining room, there is a toilet, you know? We're all the same. It's structurally similar, but inside is quite different. And this is why when we come to treat, there is no one treatment suitable for everybody. But with the technology we have now to do a prophylactic operation, if this valve here is not leaking, I can get this artery 3D printing from the CT scan and use this graft, which I'd like to pass around. This is a cast, and this graft is like a sock around the artery, and wrap this around the artery, restrict it from growing any further. That becomes a part of it. And that means I don't have to stop the circulation, I don't have to cut the artery, I don't have to have bleeding. It's great, but you know, very expensive piece of technology. 3D printing, this, that. You can imagine the price of a little car in my hand here. You can imagine why the DHB hates me. You know? I spend the money. So anyway, the developments that to do this requires a lot of equipment. And simply, you know, you've gone through the clinical presentation. Simply, I'm a human plumber. I get somebody who got a dissection, sprung a leak. The pipe has burst. They are in desperate situation. And as any plumber, you ask them to come and do a job, they need to switch the mains off. You can't work while the heart is working and everything is going. You can't do that. That is impossible. So switch the main off, okay? Well, in the house, we can stay with our water for 24 hours before everybody starts to complain and, you know, grumble at you. But the body, especially the brain, cannot last that long without something keeping it alive. And that's why we have problem with this operation. I have to stop the heart, stop the engine. I have to stop the brain too, because I need to open these big pipes while there is no blood inside them. So I stop 2 things are really important, the brain and the heart. Okay, you have seen all these images, so I'm not going to talk about them. My job, when I get there, that the lining of the pipe is split. So the pipe is split into 2. And I need to bring them back to 1. So I have to cut the pieces that split and replace it with something else. And we'll replace it with Dacron. You've seen all the Dacron around here. There is various types and, you know, various branches. It's all technical things, simple. Just replumbing the system to avoid the weak bit of the pipe. That's all we do. But again, the complexity is that I have to stop 2 important organs while I'm doing this. The more pipes I need to switch it together, the longer the time that I'm stopping the heart and the brain. And then is the recovery going to be complicated because of that. The longer I stop the heart and the brain, the more danger it is for you guys to recover well. So anyway, I'm going to go through that. It's not important. And of course, if I don't do the operation, the outcome will be bad, so you know that. That is not important either. Okay? Now, the principle of keeping the heart and the brain for a long time is again simple, freezing. Okay? We are human. We manage to improve our life by freezing things and cooling them down so we can keep them for longer. So that's exactly what I did to all of you. I'm sorry. This. I put you on ice and I stopped the circulation. And I looked at the clock and I started stitching. Because every minute I save is better for you. And that explained to you why when you wake up it takes a couple of days and the brain is, you know, not switched on completely. There is light at home, but there is nobody there, and all that stuff. But gradually, of course, things come back. But the reason for it is this freezing business. And this machine here. So you can see how efficient our heart is and lungs. this bloody big thing here with all these pipes and things and, you know, electricity attached to the mains and all this stuff just to pump the blood around the body. Well, your little engine there is fantastic, isn't it? Doesn't need all that crap. But anyway, that's what we use. And unfortunately, again, some of us, to very little information we have, allergic to this machine. You know, because it's made of plastic and all human things, you know, some of us overreact to it. So afterwards, maybe some of you needed to be on a breathing machine for longer, you know, not completely, the kidney is not working well, all that stuff is because of that machine. That's what it does to you. But it's, without it, we can't do the operation. Without it, I can't really get in there and do my stitching. And fortunately, most people recover well. It takes a while, but most people recover well if the operation is okay. The plumbing, which I love, is very simple because I'm a simple-minded surgeon. I've got one neuron, I'm focused on one thing, I can't think of anything else when I'm operating, I can't listen to music, I can't, you know, talk to other people, I'm just looking at what I'm doing. And this stitching, that's all you do. You know, tube, stitch it here, stitch it there. Yeah, simple. And, you know, lucky for us, in the past, there was no glue. Have you ever seen a plumber that put the two things together and put nothing in there? You need something else, otherwise they'll have leak. So again, lucky for us recently, we have glue. So I can stitch this and put some glue in there and some glue in there. All good, no leak. It's very important, that is. Okay? Now, we're talking about also some important pipes that supplies the heart with oxygen. So coronary arteries. So sometimes if the valve is good, and I need to keep your own valve. So your own valve is alive, it repaired itself, it worked beautifully. Anything man-made, if it's here or in China, it will be inferior, okay? So take it from me, the guy's guy will show you valves and stuff, it is inferior to the real stuff. So your valve is better to keep. Now, this is the guy who taught me how to do this one, or we can say this is the Bentel operation. He was at the Hammersmith Hospital where I was a house officer, and I didn't like him. He didn't like me either. He invented the operation though, you know, he's a very clever man. But man, to work for him, it was a nightmare. You know, and I used to do 3 ward rounds before he comes in the morning because the first thing he'll ask me questions I can't answer. And when I can't answer them, he would just ridicule me in front of everybody. And one day I got fed up with it. So he asked me a question and I couldn't answer. And he looked at me, "Now, what are you doing here then?" I said, "Sir, if I know as much as you do, I will take your place. I wouldn't be standing there to be taught. I don't know." And this is another teacher of mine who's a bit kinder and a very good surgeon. And he's still practicing, he's in 70 now in Canada. And this is called the David operation. And basically, again, I keep your own valve. I'm trying to stitch your valve back into this Dacron tube. So keep your own valve, I don't replace it. And that's again is a good thing to have if we can do it. But sometimes the valve is too damaged, I can't do that. And then I have to replace it. Now, some of you might have a cut here on the side and on the top here of the chest, and this is what we call our access to the circulation. Because the pipes in the middle are damaged, I can't really connect the machine to them. I have to use something that is not damaged on the side there, and that's the axillary artery that's going to the arm. So we use that to get an access to the circulation so we can pump the blood from the machine around the body. All right? Of course, please ask me.
Do you do femoral as well?
Yes, we do. Yeah, so we can use both axes to give us flexibility, and sometimes we can use this, if you can see where that goes, it gives the brain as well blood. So sometimes I can just give the blood circulation to the brain.
So just to say that question out loud, does Adam use femoral cannulation as well? And I know everyone heard that, the answer is yes.
Yes, the answer is yes, we use both. It just gives us some flexibility. Sure.
How do you get that around?
How do I get that around? Yeah, we'll have to.
Open it up like a part.
Yeah, this here. Can I do that? Where's the guy who sells this stuff? Can I just show them? Okay. So we unwrap it, and it opens. Very good question, sir. And then it opens like that, so I can wrap it around the artery. Yeah. And then stitch it back. All right. Very good. You can actually have a feel of it. So the good thing about this material, it feels the same as the aortic wall. It's elastic. No, the one inside we don't use. This is just only the holder. That one outside. Yeah, we don't use that. It's this one here. Okay. Now, I want to take the thunder from my next speaker, who's going to talk about when things are a bit complicated. So, what I'm going to advise you now is that blood pressure control is one of the most important things that you guys can do. And when you go and see the GP and they do just one measurement while you're sitting and happy and there's no problem, it's okay. But really, I want you to insist of having 24 hours blood pressure measurement while you're at home, while your daughter's annoying you, or your son has broken the car, or something is happening. So you know how you respond to the stress, and then we can get the blood pressure really under good control, so you save yourself for a very long term. And I think that's really what I would like to show you in the next few slides, and then I'll stop. The reason for that if we agree that we have a weak pipe because of our genetics, and we can't do anything about that to change it, what we need is to protect it from further damage and to help our body to repair it. The body have a mechanism to repair is fantastic. If you don't continue to cause damage, it will get repaired. Now, mainly not completely, but some people will have a long life without complication if that happens to them. And earlier on, somebody asked a question about 30% of people who have dissection, their aorta will be normal down the line. The false lumen will heal, you'll have one lumen, you'll have no further problems. But really, the most important thing is having blood pressure control. I'm going to go, this is just to show you the brain and the heart there. There's different ways of protecting the brain, but I use freezing, and that's the most important for me. Now, this is very important. The next one, sorry. This is very important. This is the survival after type A dissection over the years. Now, no statistics will predict individual survival. Okay, this is everybody, different ages, different stage, different type of pathology. So don't look at this and think, oh, this is what I've got. Nobody can predict that, and I'll tell you a story in a minute. So this is survival. Now, if you look here, this is two curves. The top one, people who had blood pressure control with the beta blockers, and the bottom one, people who did not use any medications. So the message from me really to help you is to make sure your blood pressure is well controlled, and controlled in your daily life, not just when you go and see the GP or the nurse. You need to do the 24-hour measurement, and you need to make sure that the majority of the time your blood pressure is well controlled. And this is really the message from my talk. Now, I'll end my talk with a story about prediction. So, because I have a passion to be a good human plumber, when I was young, in David's age, I decided to go to America to do a fellowship. And my wife was against it because they don't pay you as well. You work like a dog all the time. And how she's going to look after the house and everything else. So anyway, the discussion went on, I need to do this, otherwise I wouldn't get anywhere. She accepted it, and I traveled to the States to do 2 years fellowship. And my first night, it was Christmas night. Funnily enough, I was on call. So anyway, a patient comes in, chest pain, classical signs, acute dissection. And the patient was living in another town, so he was visiting in business to work. This place was, which is a Connecticut Yale University, New Haven. And he comes in, I saw him, had a good discussion with him. And the American system, there was a book about complication. I swear upon God, there's a book. It took me about half an hour to read all the complications from the book. So the guy listened to me and said, oh, so there's a good chance I can die going through theatre today. I said, yes. He said, well, I need to see my family before I go through, because, you know, it might be the last time I'll see my wife or my daughter. Where is your family? 3 hours away. Okay. Well, you know, that's his wishes. My boss was angry. He said, I never work with the American guys. And he came in, white coat, you know, looks really smart. Got in, he said, who are you? I said, I'm the new resident, sir. And I backed out. And he said to me, what's happening with this patient? I said, well, he doesn't want to have the operation yet. Do you know that this problem got 1% increase in mortality every hour you wait? I said, yeah, I know, but he doesn't want it. I just can't convince him. So he goes and talks to the patient. You need to sign that consent form right now. I'll take you to theatre, fix you up, or you're going to be dead. All right? The guy said, I'm sorry. I'm waiting for my wife and my daughter. I'm not going to go. Anyway, so he refused. The professor goes away, and it's 7 o'clock in the morning. The guy saw his wife, his daughter, was very happy. By the way, he told me what he does for a job. He's an undertaker. So I was, okay, all right. Anyway, we go to theatres, and you know, I was like, David wanted to operate and do stuff. And so I started doing. And then, you know, an hour later, the boss is not there. So I ring, I talk, we can't get touch of him. And then, you know, the guys in there said, oh, have you done this before? Yes. I'll continue. I'll continue. Okay. Do it. Okay. Now I finish the operation, and then the nurses come and crying to the theatre. What's happened? The boss crashed his car in a tree in the night and died. Okay? So the lesson for me is, as a doctor, I can never predict what will happen tomorrow. I know you guys all ask. I don't know if I'm going to be here tomorrow myself. I don't know who's going to live or die. I can only tell you statistics, but it doesn't help very much for individual patients. What is written in the star is written, if you believe. And you know, that's my moral story, really. We're all going to have to enjoy what we have now and make the most of it. And it's a great pleasure to see you all here today. Thank you.